I will now give a lecturette entitled How to Live a Life with a Possible and an Actual Cancer. This lecturette contains my thoughts, perceptions, opinions, and recommendations. In our life on earth, any kind of disease, including cancer, is always a possibility, and there is no sure shot way of prevention. This is because all diseases, including cancers, are often caused by an interplay of a lot and combination of risk factors that no one can really identify the exact cause. With the exact cause difficult to identify, there is no sure shot way of prevention. Focusing on cancer, any person can develop a cancer anytime and in any part of the body, in spite of effort to prevent or mitigate the modifiable risk factors, such as the environmental and lifestyle factors, particularly on diet and exercise. One has to accept this reality and live on. Just hope and pray. The stance of everybody should be acceptance of the reality, but with continuance of avoidance of all known modifiable risk factors for all types of cancer. Non-avoidance of all known modifiable risk factors carries a higher chance for developing a cancer, whereas avoidance of all known modifiable risk factors carries a lower chance for developing a cancer. After acceptance of the reality that cancer is always a possibility and avoidance of all known modifiable risk factors for all types of cancers, the next thing to do is to learn the alert signs of cancer so that if a cancer unfortunately develops, it will be diagnosed early enough through self-monitoring, specifically through listening, feeling, palpating, and examining one's body. Alert or warning symptoms of cancer consist of the following: change in bowel or bladder habits, a sore that does not heal, unusual bleeding or discharge, thickening or lump in the breast or elsewhere, indigestion or difficulty in swallowing, obvious change in a wart or mole, nagging cough, or hoarseness. There are other warning symptoms, but the above are the more common ones. Knowing the alert symptoms of cancer should be accompanied by a must-do self-examination of one's body, which should be done regularly and continuously, at least once a month. Skin and soft tissue self-exam, mouth self-exam, neck self-exam, breast self-exam, and abdomen self-exam. Self-examination consists of regularly looking and palpating at the body parts that can be seen and touched by oneself for anything that is unusual. For anything that is unusual. If anything unusual is observed or discovered, it should be brought to the attention of a cancer specialist as soon as possible. Personally, I don't recommend routine screening diagnostic tests for cancers. I prefer a screening approach that consists of the following: self-examination monthly, cancer specialist clinical examination yearly, selective screening diagnostic tests for persons with high risk for a particular cancer. All the above can promote early detection of cancers and cost effective at that. There are many cancer specialists in the community. One just has to choose who is a cancer specialist on the type of possible cancer that one may have, such as choosing a breast cancer specialist for a possible breast cancer, a head and neck cancer specialist for a possible head and neck cancer, an abdomen cancer specialist for a possible abdomen cancer, etc. Aside from choosing a cancer specialist on the type of possible cancer that one may have, one has to choose one who has a track record of being competent, trusted, and compassionate. If a cancer is diagnosed, one should be treated as early as possible by the chosen cancer specialist. Early diagnosis and early treatment is the recommended complementary set of actions that should be done by anybody with a cancer diagnosis, as this set contributes to better treatment outcomes, particularly in terms of lesser complicated treatment and complications and better survival rates. Early diagnosis and late treatment is frowned upon, and more so, late diagnosis and late treatment. During and after treatment of a cancer, the following are the recommended strategies on how to cope with the psychological or mental stress associated with a cancer diagnosis. Acceptance of the cancer, trust in a competent and compassionate physician, spiritual trust, support from loved ones and significant others, cancer journey sharing, intentional living plan in the light of cancer. Acceptance of cancer. After the establishment of the definitive diagnosis of cancer by a trusted physician, acknowledge it as soon as possible. It is better and psychologically, both emotionally and mentally, to face head on the cancer than try to deny it. After acceptance, concentrate on planning and deciding with a trusted and compassionate physician the realistic goals of treatment, whether to aim for complete remission or just palliation, most cost-effective, inclusive of affordability, medical management based on the goals, and coping tactics that will be harnessed for any psychological distresses that have been identified. Trust in a competent and compassionate physician. Even before cancer strikes, identify already a trusted physician to seek right away for consult and medical management. Identify a competent and compassionate cancer specialist. Competent not only in expertise in the medical management of the cancer, but one who also provides psychological and psychosocial therapy and support simultaneously with the medical management. Compassionate not only in expressing sympathy, but one who also exerts tangible efforts in providing the psychosocial therapy and support, inclusive of easing the financial burdens of the cancer patients and relatives. Spiritual trust. The concept of the word spiritual, as will be used here, is that it is not exclusively equated to religious or identified to a particular religion or referring to the presence of a God, a creator, or a higher power. Spiritual will be operationally defined here as one relating to deep feelings, thoughts, beliefs affecting the human spirit rather than to the human body, material things, and physical surroundings. It is something beyond the physical world. In the Philippines, oftentimes spiritual is used to refer to something religious, to a religion, or to the presence of a God or creator. Whatever spirituality a cancer patient has, she can seek or rely on it to use as a coping tactic for the psychological distresses she is having. A caveat is still to factor in the usefulness and limitations of medical sciences when using spirituality as a coping tactic. Support from loved ones and significant others. The advice is not to do it alone. Seek the support from loved ones and significant others to cope with the fear, sadness, personal apprehensions, and particularly the psychosocial apprehensions. They can provide great assistance in coping with the psychological distresses in case the cancer specialist is not providing or cannot provide psychosocial support. A caveat is for the loved ones and significant others to fully support whatever sensible decision is made by the cancer patients on the management of their cancers. Cancer journey sharing. This is encouraged to show as it shows acceptance. Acceptance is the most effective coping tactic for the psychological distresses of cancer patients. Cancer journey sharing or sharing cancer stories is a meaningful and effective way to raise awareness about cancer, its treatment, prognosis, psychological distresses, etc., as well as to provide psychological and psychosocial support therapy not only to others, but also to the sharer herself or himself. Intentional living plan in the light of cancer. Living a life with cancer is a journey into the world of cancer. The cancer world is full of uncertainties, such as unknown specific causes, always with the possibility of recurrences after treatment, and not knowing the mode and time of exit, to name a few. The journey or voyage is rough with unquantifiable physical pains and psychological distresses. Everybody with a cancer must formulate an intentional living plan in the light of a cancer diagnosis. Although cancer is not always a death sentence, especially those who consulted early, diagnosed early, and treated early and correctly, recurrence is always a possibility. For those with advanced cancer disease and recurrence, they will have limited lifespan left. Whatever groups of patients with early or advanced cancers, they must continue to live on. With a well-formulated intentional living plan in the light of cancer, all cancer patients must continue to do the following with the support of a compassionate cancer specialist, spiritual advisor, and loved ones and significant others. Continue to be productive, to have a peace of mind, be contented, enjoy life, be happy, reach the realistic longevity targets, and be ready to face curtain calls or death. For those who are near the end of life because of cancer, the intentional living plan should include the following. Try one's best to stay alive and productive up to the last moment. Make peace with God or Creator or higher force. Make peace with everybody. Endorse material possessions. Make clutter management of earthly possessions. Make an advance directive about healthcare and funeral arrangement. Bonding with family. Enjoying oneself to the fullest up to the last moment. So the overall advice is to have acceptance of cancer as the first step in living a life with possible and actual cancer so as to live a functional and meaningful earthly life as long as possible. More specifically, make peace with the cancer disease or cancer diagnosis, let go but not giving up, continue to live a functional and meaningful earthly life as long as possible through your well formulated intentional living plan. This ends my lecturette, How to Live a Life with a Possible and an Actual Cancer.